Hey folks, welcome back to Girl Talk. We are still enjoying ourselves here at Radiance Skin Therapy, right off the Beltline near Todd Drive. And we have been joined by the lovely Miss Ann Pientka. I'm sure you recognize this familiar face. We're so glad to be here. Thank you.
Thank you.
As always, glad to be here, glad to learn about new beauty treatments.
Yes.
I was just saying before we started, we're so thankful to live in an era where you can get such great results without going under the knife.
Yeah.
And I've looked at the before and afters for this topic. It's incredible. So we're actually talking today about how to treat the double chin, something that so many women and just people in general really have struggled with, and now there's a way to do it. So there's something called Kybella. So
Yes.
tell us what this is.
So Kybella is the new and only FDA-approved product to get rid of submental or chin fat.
Yeah.
And it's for both men and women. It's a struggle for both sexes,
Yeah.
sometimes even more for men. But it's a particular product called deoxycholic acid. And that is a molecule that's already in our body that helps absorb and destroy dietary fat.
Bring it on.
Right?
Yes, right.
So they now have the product, concentrated version, and we inject that into the chin fat, and it will destroy it.
Wow.
Okay, so it's an injectable treatment, which is awesome.
Yes.
It
Yeah.
used to be what? Surgery, liposuction,
Yep.
that
Yep.
kind of thing?
Mhm.
Okay.
Yep.
So how does it actually work? Does it dissolve the fat? Does it absorb it?
Yeah, it's just a molecule that'll break it down and destroy the fat cell. Kind of like, we talk about cool sculpting or ultra shape. There's all different ways to now actually destroy a fat cell. But this is an injectable product, and it is only now used for the chin. Of course, we get calls saying, can it do it
I was just
every
gonna
place?
ask that. I have a lot of places that I could probably
We'll be here all
inject
day. So it's specifically for the
It's specifically for the chin. I mean, who knows what's going to happen with it down the road, but for right now, we're sticking to the area of the chin. And it can't even be outside of really the chin area. It can't go all the way across the neck. We have definitely structures in our neck that we don't want to put that product there. So it's basically kind of right here. And of
Right.
course, it's going to be for people. We still need our surgeons because if you do have a tremendous amount of laxity and we take out fat, then we have more laxity. So it's not for somebody with a lot of fat and a lot of laxity.
Right. But say what you were saying before we started about, we've already picked Ann's brain about this, we were really excited, but about what you were saying about the swelling and sometimes how that can actually affect.
Right. So if you have a little bit of laxity, we wouldn't be concerned about that. They kind of state in the studies that because of the swelling, and you do get a little bit of swelling with this, so it might be something that you do when you have a couple days off. And so, but that swelling effect actually kind of constricts the tissue for us.
Yeah.
And so it can be, it's not definitely if you have laxity, you can't do it. It's just kind of an assessment of, who's the right candidates. And I think when we choose the right candidates, we're going to get those fabulous results that
Absolutely,
you see
yeah.
on those before and after photos.
So impressive.
Yeah.
And how many treatments are we talking?
Well, and that's again, so we can have 3 different people sitting here and they all have a different amount of fat. So that's going to matter. So we usually state anywhere from kind of 1 to 6. I mean, that's really broad. But I think on a general sense, 2 to 4 is kind of what we're seeing.
Okay.
On average, sure.
Yeah, so 2 to 4 treatments, and there's space generally. At first we were kind of spacing them more on a 6-week. Now it's kind of looking like we space them a little bit further out. So again, that's an individual.
Assessment,
Yeah,
yeah.
exactly.
Okay.
So yeah.
Wow, that's great. Well, I mean, I think for somebody who is struggling with this kind of thing, the idea of a couple of treatments, even if it is 4 or 6, I mean, to have the great results that it supplies is, I would think,
Right.
worth it to
Yeah,
me.
Absolutely.
Absolutely.
So after you get your treatments, let's say however many you need based on the individual, is this something that they're going to need to continually come back and maintain? How does that kind of work?
No. I mean, we say now that, right? For once, we can actually say, no, you shouldn't have to come back for treatments. when we get you to the point that the fat, again, we're destroying those molecules. So unless I think you would have some really large weight gain or something, yeah, it's a possibility. But if just like kind of in that cool sculpting where we talk about that, you maintain things where you're at.
Right.
Once they're destroyed, and we're not usually going to put on a ton of fat back on in the chin area.
Right.
There's usually sometimes a genetic component to this. You know, it's weight gain. There's hormonal fluctuations and all that too. But
Because you're not shrinking the fat cell. You're actually eliminating that cell, so it goes away and never comes back. Your body essentially gets rid of those cells.
Right.
So you're not going to regenerate them.
Yeah,
Okay.
exactly.
Makes sense. Yeah.
So now that we have everyone's interest,
Yes.
and we're all feeling a little more self-conscious, how much does this cost typically? And again, it's going to vary, I'm sure. but-
Yeah, it's going to vary. You can expect around a $1,200 treatment. So it's not a cheap venue, but it doesn't involve any cutting, and it doesn't involve any incisions.
And it's kind of a forever.
Yeah, lifelong.
Yes,
Right.
exactly.
Yeah.
Yeah. So a lot of things we do here, you have to come back, and there's an expense to that. This one, usually not.
Yeah.
When I'm done.
Yeah.
So Anne, real quick, how do people make an appointment? Do you want them to stop in? Just give you a call?
Usually give us a call because we're usually booked with clients. Jessica's here to answer the phone and answer more questions. Or you can visit our website. We do have videos on there and question and answer.
Awesome before and afters
Yeah,
as well.
and then absolutely make a consult. We can assess, see see what you need, tell you more about the costs.
Yeah. Well,
Thank
thank
you
you
so
so much. You are the best, and you have the best team over here. I think we all can agree to that. So thank you for always sharing all these great, fabulous new things that we can do without surgery. So it's wonderful. This is Ann Pientka over at Radiance Skin Therapy, and thanks to all of our guests for joining us. Thank you for watching. We'll see you next time on Girl Talk.